So these guys, we should have brought our little cutaway of a seal, but their esophagus, if this is the seal's mouth and he's looking at you, he's got the opening of his airway down here, and then right above it, which is kind of collapsed, it just kind of looks like a little, like this, is his esophagus. So when we're tubing him, you're kind of passing the tube up kind of along the roof of his mouth, and so that puts it above the larynx. And the larynx has tremendous protective reflex. I mean, it's what keeps all of us from aspirating water and aspirating food and such. So when anything kind of touches it, it automatically closes. But you can time this just right. In fact, that's how we intubate animals and how you're intubated if you have surgery, is you wait for that larynx to open and you get in there real quick before the larynx snaps shut. So tubing is always kind of a slow, deliberate process, and if you wait for a swallow, the swallow is automatically closing the larynx, and so there's a lot of things like that that kind of keep you out of trouble. These guys have kind of short, furry necks, so in some animals we'll actually put our hands on the throat and you can feel the tube bump by your finger. Kind of hard and not very reliable in these guys, so we don't do that. But so first you're measuring the tube, because I think we talked last time, you want it to go back right to about the end of his ribs, because you want to know it's in the stomach. If you tube him up here, you may be in his digestive tract, but there's a valve at the opening of the stomach, and if that valve is closed, which it normally is, and you fill the esophagus with milk, then he may regurgitate it right back over his larynx and suck it in. And in fact, when we've had animals that have died of aspiration of formula, it's probably more often from people intubating into their esophagus and not their stomach than it is actually tubing them in the lungs, because we'll in many of those find milk in the stomach and milk in the lungs. So there's a couple of things, probably the most important is measuring tube length and making sure you're far enough, and you're really not going to hurt anything. I mean, if in doubt, you want it to go a little bit further. So when you're passing the tube, there's going to be resistance getting it into the esophagus, and then the esophagus is just kind of a flaccid, collapsed tube, so it should pretty easily go along. Sometimes it'll kind of have a little hang up when you get to the heart, as the heart pushes up on the esophagus, and then once it gets to the cardia, or the opening of the stomach, that's where the valve is, and so sometimes you have to kind of just sit there for a minute, and then it'll reflexly open and you can pass it in. Once you get in the stomach, there's a lot of room in there. I mean, this is fairly flexible tube, so if you're going too far, it's not like it's going to poke through out in his abdomen, it's just going to kind of curl around. So I always, when I measure, I'm kind of not in the scrunched up seal who's nursing on somebody's finger, but if you kind of really look and see what the length is, and kind of figure you're about half the length of the body, not half the length of the seal, but about half the length of the body back. So, and then once it gets there, sometimes you'll hear gurgly sounds if it's sitting in some milk or fluid in the stomach. And if you're listening to this, if he goes "Mom" at you while the tube is in, he can't do that if this is in his airway. So you're safe right there. So as long as you know you're far enough, then you're good. If you're there and he's not vocalizing and you're not hearing anything, then there are different things you can do. Sometimes you'll see a little fluid flow back in the tube. That's almost assuredly got to be his GI tract, or he's really, really sick if that's coming out of his lungs. You can gently, if you don't mind sharing germs with a seal, just do a little, just a little puff of air in there, and you'll hear it bubbling. You can just do a little puff, and then you can listen and hear it bubble, bubble, bubble back at you. Or I've seen some people who have somebody else listening down here and seeing if it's bubbling. I kind of like to do it all myself, because I pass the tube. I'm responsible for what happens to them. So
can we put the flipper back and measure from that? Or how?
measure
from
just
the
seeing
end of the,
where it goes.
Yeah, the end of the flipper. Is that reliable at all?
Well, if you have it straight, you can see that's right back at the back of his rib cage.
Okay.
So it's the same spot.
Okay.
And you can feel his rib cage, so right where he starts to get kind of squishy there.
So you can measure from just the rib cage to the end of the skull.
Mm-hmm.
That's what you're doing. Because they don't hold still, obviously. But okay.
No, they don't hold still real well. So I'm just passing it on the roof of his mouth and just kind of going slow. And he's vocalizing, which is nice. It kind of met resistance, and then he swallowed. And he's still making noise, and I'm at my rubber band, so I've got a couple of good signals. And it's really very quiet down there. One good thing is I see that he is breathing regularly in and out. There's no airflow at all in the tube, and sometimes you'll get, if he vocalizes because he's pushing up on his diaphragm and in on his chest, you can get a bubble there because he's also compressing his stomach, so you can feel some air. But
oh yeah.
And did you hear that? There's great resistance, but it bubbled into fluid and it came back out as fluid. So, and then you could hear a little bubbling there just as he was struggling.
If we're tubing this animal and we see some old formula coming back up through the tube, is that cause for concern, or what shall we think of that?
No, because his stomach's not it should pretty well empty, but there can always be some residual fluid, and if your tube is down in that pool of what fluid may be at the pylorus ready to leave, and he grunts like that, it could easily come out. So if somebody wants to tube him,
to go ahead and push fluid around. Okay.
Yeah.
All right.
Now, if you've got it in there and it came shooting back out the tube, and it's an animal that had vomiting problems or something, then you'd be concerned that maybe things aren't passing.
And Chris, I hope everybody saw Chris put this in her armpit to keep the tube straight. So we have the bubble at the top of the string.
Yeah, so there's
in the middle.
the little bit of air in there is just so you know that you completely empty the tube out. Otherwise, as you're pulling it back out, you could do the same thing. You could drop fluid or formula at his larynx and potentially have him aspirate it.
If he wasn't vocalizing and you heard that little gurgling coming out, how do you know that's not from his lungs?
Well, his lungs should be dry. There should be no fluid.
But maybe you hear air coming out of his lungs. Somebody,
well,
I've been told that.
If you hear air and it coincides with him breathing, then you want to start over.
Right.
But if it's just an occasional puff of air and it's associated with him struggling, it's just him contracting and pushing fluid out. Because the stomach, if you x-ray that stomach, there's probably a bubble of air and fluid underneath. So there's usually always some air in the stomach and a little bit of fluid. So, and then another question was, okay, we do tend to burp them afterwards, and because we're feeding them artificially and we are putting a little air, sometimes maybe a little extra, it seems to be beneficial for them to get the excess air out. We see people sometimes putting them up on their shoulders. I absolutely think you shouldn't. I think they should be on the table in that position. The air is going to tend to rise to the top of his stomach, and the cardia, the opening that goes up his esophagus, is at the top of his stomach. So he's in a perfect position to burp if he's going to, just like that. And so just a little gentle tapping. You don't have to do it for a long time, but everybody that's been feeding seals has heard that satisfying burp and think, oh, okay, the baby's ready for bed now, we're ready for its swim. So it's definitely a good thing to do, but you don't want to get the seal up where he's close to your face. They do get teeth very quickly, 8 to 10 days. All of those things, if perceived by the public, we're coddling them and babying them, we're not treating them like wildlife. They'll certainly cuddle with you, they'll sit in your lap, but really because they're not pets, and we want to do what we medically need to do, but I don't think they need to sit around and necessarily be nurtured by us. So
everything to remember is keep